So today I'm going to be talking about ways to understand dyslexia using a case study format, which I have found very, very effective in working with teachers and teacher candidates. But I'd like to begin with a little bit of background. So I always like to start a talk with an anecdote or a story or a cartoon, something like that. And one of the courses I've taught for many years is a Research in Learning Disabilities course. And as part of the course, students select a topic for a research paper. And one of the topics is dyslexia. And so one semester I had this student who asked her principal, did he think dyslexia would be a good topic for her to choose? And here was his response. You should probably choose a different topic than dyslexia because in our school we only have one child with dyslexia. Okay, so let's think about this. The estimated incidence of dyslexia, even by relatively conservative estimates, is 5 to 10% of the population. That figures from the International Dyslexia Association. This was a large school that the principal was from, for maybe 300 students. So there were probably at least 15 to 30 children in that school who had dyslexia or more who, obviously were not being properly identified, right? I think probably this content is familiar to a lot of you, but I'm going to go over it sort of quickly just so that we're all on the same page as to what I'm talking about here. So key features of dyslexia are well understood. The central problem for the individual is learning to decode and spell printed words. Usually this problem is based in phonological processing, not always, but in the majority of the cases. And phonological processing has to do with processing sounds in words. These individuals generally have broad language comprehension that is at least average or better, and also broad intelligence is typically average or better. A person with dyslexia could have a specific deficit, specific cognitive weakness in an area like, say, working memory, but overall cognition is solidly average and sometimes much better than average. However, having core difficulties in decoding, even though a decoding weakness is a relatively circumscribed type of weakness, can lead to many secondary effects. So if you can't read the words, you're not going to have good reading comprehension, right? If you have poor spelling, that's going to have negative effects on writing. Motivation is often affected because after potentially years, we hope not, but potentially years of struggling and failing, the student loses motivation to keep trying. If students can decode a text accurately and fluently, typically comprehension is good. This is a really important thing to think about when you're thinking about students with dyslexia. They don't typically have actual comprehension weaknesses. They have comprehension problems that are an offshoot of the decoding problem or the fluency problem. Also, dyslexia often co-occurs with certain other disabilities, especially ADHD. Some studies say maybe a 40% or so comorbidity rate. So that not all of the students will have ADHD, certainly, but it's a common co-occurring disability. Difficulties can range from mild to severe. Most research suggests that the children do not need a qualitatively different approach to decoding instruction. In other words, it's not that they need a completely different kind of phonics program from what other kids benefit from, but they typically need more intensity of instruction. And this would certainly be true for children that have a more severe case of dyslexia. So intensity is usually manipulated by more instructional times, a smaller teacher-student ratio, more opportunities for practice, things like that. It's important to note there's other kinds of reading disabilities. So how many people here are special education teachers? Okay, so if you're a special ed teacher and you serve students with learning disabilities, dyslexia is probably the most common reading disability that you would see, but there's a couple of other reading disabilities also that are well documented. Specific comprehension disabilities involve students who have good decoding skills. So the student does not have a history of decoding or phonological weaknesses, but nonetheless, they struggle with comprehension. Usually, the comprehension problems will manifest in both listening and in reading, but it's not because of decoding. So it's a different type of reading problem. Also, some students have broad language disabilities. These are the kinds of students who might be served when they're younger by a speech path, but then as they get older, reading becomes an issue because learning to read depends on language. So often these students have the kinds of decoding problems that you see in dyslexia, but they have broader language problems as well. They might have limitations in vocabulary or grammatical competence or pragmatic language, something like that. So these students are not going to be the topic of today's talk, but sometimes it's helpful to contrast not just examples of dyslexia, but non-examples, what are other types of reading problems. I wanted to talk a little bit about assessment before getting into the cases because I think it's helpful to think about certain details of assessment. So first of all, a good assessment for struggling readers, this is not, if you're a general education teacher, it's not the type of assessment you're going to do certainly with every student, but for a really, in-depth evaluation of reading, it's very important to have measures of component reading and language abilities, not just a broad measure like reading comprehension or even reading fluency. And by component measures, everybody know the 5 components of reading, right? So by component, that's what I mean. Phonemic awareness, fluency, decoding skills, oral vocabulary, things like that. Important component areas to assess, again, in a really thorough diagnostic evaluation would be out-of-context word reading and decoding, phonemic awareness for beginning readers or in a reader of any age if decoding is weak, text reading accuracy, so for that you need oral reading because you can't judge accuracy if you don't hear the child read orally. Text reading rate and prosody, which is intonation and phrasing, another indicator of fluency besides speed. Oral vocabulary. Vocabulary has to be measured orally because if you use a test that requires reading, it confounds vocabulary with decoding, right? So you need an oral vocabulary measure. And listening comprehension, and in a typical special education eval, this could be something like Woodcock-Johnson oral comprehension or Wyatt oral discourse comprehension, something that's sort of a broad measure, but more in-depth assessment if a child has significant weaknesses in this area. Again, that's not typical of students with dyslexia, but it could be true for other children with reading problems. A range of measures can be used as long as they are technically adequate and they have benchmarks or norms to determine how a child is performing relative to grade and age peers. And one of the handouts, the first one, I think, is a chart that just gives you some examples of useful assessments of these different component areas. Standardized tests are typically required to determine eligibility for special education, but other types of measures can be very useful for planning instruction. So one of the children that we're going to look at has core phonics survey data. I don't know how many of you are familiar with that. There's another similar test called the GE test, and another one, if you use the Wilson program, is the WADE, is very similar. And I'm always surprised to find a lot of these tests, at least in my neck of the woods, are not sort of standard things that all teachers use, because really I don't know how you teach decoding if you don't know what are the patterns the child has already mastered and what do they need to learn next. So these aren't norm reference tests, but they're still very useful for educational purposes. And then CBMs, curriculum-based measurements like DIBELS Next or Ames Web, are very useful for screening and monitoring progress in intervention because they have certain features that make them really useful for those purposes, like they're quick and easy to administer, they come in multiple equivalent forms, they're sensitive to incremental progress, and so on. Okay, so a few details about each of these areas, just things that will kind of come up in the cases. Okay, so to evaluate word reading, it's important to use both real words and nonsense words. These could be mixed together on the same measure, or it's kind of useful to have two separate measures. But nonsense words like streck and glean provide a pure measure of decoding. So they give you an indication of how a child will approach an unfamiliar word. Do they understand the alphabetic code to be able to sound out the word, or are they going to just guess based on the first letter? If you only use real words, children can be relying on sight word knowledge. They could have memorized those words. However, information about the real words is important too. So for example, if real word reading is in average range and nonsense word reading is low, that's a pattern that suggests a child is relying on memorization of sight words. That's a pattern you often find in younger children. It's a hard pattern to sustain because you just can't be a good reader relying purely on memorization of individual words, but maybe in a first grader or a younger child. But also, you can find children with the opposite pattern, where nonsense word reading is average and real word reading is low. That's a pattern I see pretty often. I do a lot of consulting work in public schools. I'm often asked to consult on cases of students with dyslexia. And a very common pattern I see is a student who has had years and years of phonics remediation, Wilson or OG or Lindemood Bell, programs that are regarded as good programs and very appropriate for this population. And the child's decoding, as measured by nonsense word reading, may be totally normalized after years of intervention, but real word reading is not. In some cases. And it's a fair, I don't know, what proportion of the kids it is, but I mean, it's a problem I've seen on a number of occasions, and I've also seen reference to it in the scientific literature. So this is a pattern that suggests the child is not transferring decoding skills to reading of real words or not building a sight word bank of real words. And we'll talk about this problem later in relation to a specific case and what are some things that you could do about it. Also, when evaluating word reading, it's important to consider automaticity as well as accuracy. So if a child gets all the items right, but they have to, laboriously sound out words and they're not automatic, that's also a problem, and particularly as children get older and they have to be able to read connected text and greater volume of reading. Okay, a few words about reading comprehension. So there's a number of different formats for assessing reading comprehension, but two very common ones include close, which is like a fill-in-the-blank type of format. So the child reads something like, the duck was swimming in the blank, and then they have to give you a word like pond, water, lake, something that makes sense in the blank. But the child has to be the one to read it. And then the other common format is question answering, and that's probably the format that's really familiar to everybody. You read a passage and you have to answer questions about it. Very important thing to know is that individual children's performance can vary substantially depending on the comprehension measure. So overall, children do tend to perform similarly on these measures, but when you look at individual cases, you can find individual children whose performance varies quite a lot in some cases. With tests that involve answering questions, it's especially important to consider whether questions are passage independent. And I don't know if any of you, if you've studied or heard of Jan Keenan's work in this area. She published a pretty well-known study a few years ago on the Gray oral reading test. And that study spurred the revision of the GORT. That came out, the GORT 5, or whatever the most recent edition is. So passage-independent questions don't require actual reading of the passage. So an example would be, let's suppose a child reads a passage and then the examiner says, you know, what does the word glimmer in line 32 mean? Well, a child with a good vocabulary might already know what that word meant, right? So they didn't have to read it. Or sort of common sense questions like, how do you think John felt when he lost the prize? Well, he probably felt bad, right? I didn't have to read the story to know that. So, so children with dyslexia, the way this is relevant for students with dyslexia, often these children have strengths in vocabulary and background knowledge and broad language, and they can often do well on passage-independent questions and may perform relatively better on Q&A measures than on cloze measures. Furthermore, the use of these kinds of questions can cause some children with dyslexia to appear to have better reading comprehension than they actually do. And so children, I've many times seen students with dyslexia score in average range. And the reason this is important is then I sometimes get schools telling me, well, okay, decoding is weak, but you know, reading comprehension is average. So what's the problem? He has good comprehension. Well, no, it's still a problem that decoding is weak because the average reading comprehension score really probably just reflects the nature of the test. It doesn't reflect, it certainly is not telling you that the decoding is never going to affect comprehension. If it hasn't yet, it will in the future without intervention as books get increasingly demanding, right? So that's really why I think it's important to sort of recognize this, that the average reading comprehension score does not necessarily mean that decoding is not affecting comprehension. In fact, in my experience, if I talk to the teachers, they'll almost always say, oh yeah, the student has trouble keeping up with classroom demands and that kind of thing. Another important consideration is that very few standardized tests approximate what we expect middle and secondary students to do in reading comprehension. So a typical classroom assignment at a secondary level might be, you know, reading 2 books and writing a paper that contrasts them in some way. Well, there's really almost no standardized test I'm aware of that approximates that kind of demand. So again, the bottom line is a verbally bright student with dyslexia can sometimes score in average range in reading comprehension, but still struggle a great deal with everyday reading comprehension tasks because of their limitations in decoding or fluency. Also, a few words about listening comprehension. Listening comprehension is often a strength for students with dyslexia. However, children can sometimes do poorly because they have attentional or executive function problems, especially if you have a student with dyslexia who has co-occurring ADHD and they do poorly on a listening comprehension measure. This would be something important to think about. Listening measures are demanding of attention because basically the student has to just sit there and listen, right? So if focusing one's attention is not a strength, then it can show up more on this kind of test. It's important to try to figure out with students like this whether what is going on is really a language issue or is it an attentional issue. And the reason that's important is it's different intervention. If you have a language weakness, you're going to intervene with language, or maybe the speech pathologist will do that. If it's an attentional weakness, or an executive function weakness, you usually want things like organizational strategies, avoidance of multitasking, having the student in a quiet environment. It's different. So some things to think about in determining whether there's really a language weakness. Does the child have a history of language delay in preschool? That's very relevant even if you're working with high school kids. So if the child had early language delay that was documented, that suggests some kind of underlying language weakness, that a vulnerability that could be there. That would make me sort of think more that could be a language issue. If the student has had comprehensive speech language testing, that's usually if it's a good eval, it's in pretty it's in a lot of detail usually. So usually if a child has a language weakness, you would identify it there. If they have an ongoing weakness in expressive language, that again would suggest language types of problems. Okay, so for the first case example, I will do the student just because this student is what I would consider sort of a classic case of dyslexia. So I'll do this one as kind of a model, as an example, and then I'm going to give you some cases afterwards. So, and all of the kids that I'm going to talk about today are, the test data are authentic tests. They're based on real children. These are children that have either come to our assessment clinic at Southern that I run as part of a course, or they're children that I've encountered in public schools, of course with names and details changed to protect their identity. But the actual, they're not made up, they're actual, the data is authentic. So Danielle she was at the end of grade 2 when I knew her. No history of early language delay, but she did have a family history of learning disabilities, which, as other speakers have said, is very common with these children. She experienced reading difficulties beginning in kindergarten. This would also be a very common presentation for dyslexia. Sometimes those difficulties are missed, but usually looking back, you can see that there were difficulties. Her early difficulties centered on learning letter sounds, phoneme blending and segmentation, and decoding. So again, phonological types of skills. She's always done well in teacher read-alouds and class discussions. She's had intensive explicit phonics interventions since early grade 1, so she did get identified early, and she did have appropriate intervention. Reading comprehension is good if she can decode the text. Math is grade appropriate. She has good ideas and good vocabulary knowledge for writing, but poor spelling drains her motivation to write. She has trouble getting it down. And this shows her test scores at the end of grade 2. These are from the Woodcock-Johnson. How many people here have some familiarity with formal testing, like with the Woodcock-Johnson? Okay, great. So then, as those of you know, average range on the Woodcock-Johnson is 90 to 110. And in the list of scores, I've highlighted in red the scores that are below average. So you can see that word identification, which is reading real words, is kind of a lot below average, considering a student who's had almost 2 years of intervention, right? Word attack is also below average, but better. So she's made more progress in phonological decoding skills than she has in real word reading. She's one of those kids that I alluded to earlier. Passage comprehension is also below average at 80, but compare passage comprehension to oral comprehension. Now, if you're familiar with this test, you know the format for each of those two subtests, passage comp and oral comp, is exactly the same. The items are different, but the format is the same, and the only difference is for oral comprehension, the examiner has to read it to the child. For passage comprehension, the child has to be the one to read it. And notice, when the examiner reads it, comprehension is 120, above average. Okay, so comprehension is very strong. When she has to read it herself, 40 points lower. That kind of differential, that's the hallmark of a decoding problem. When you see, a big differential between oral comprehension and reading comprehension. Spelling also was low, as we would expect. Sentence reading fluency couldn't be administered because the child couldn't do the sample items because she couldn't read the words. On a set of graded word lists, her highest instructional level was primer, which is middle of grade 1, and for passage reading, it was pre-primer, which is early grade 1. Yes? What does IRI? It stands for Informal Reading Inventory. So series, there's a number of commercial inventories, and I don't know if you all give the DRA out here. That's a kind of a reading inventory kind of test, but it's reading word lists and then reading passages. And the passages are scored for both word accuracy and comprehension. So how does this student's difficulties exemplify dyslexia? Her literacy difficulties revolve around decoding and spelling. She has problems with reading comprehension and written expression, but those are due to her decoding and spelling problems, not actual comprehension weaknesses. Her positive family history for dyslexia is very common, though not universal. Her ability to learn verbally is strong, and there's no co-occurring ADHD in this case. One other thing I should mention about how her difficulties exemplify dyslexia, this is a little girl who got intervention for what most of us would consider a pretty good amount of time, right? Almost 2 years, and she's still really struggling. And the intervention was generally appropriate intervention. There's like room for improvement. We'll talk about that in a minute. But she was getting systematic phonics using an appropriate type of program. So we know her difficulties. Another way her difficulties exemplify dyslexia is we know this is not a curriculum casualty. We know this is not just a student who didn't have the opportunity to learn, because she has had the benefit of phonics instruction. And most children, if they didn't really have a disability, they would be doing better than this, right? So that's another way her difficulties are typical of dyslexia. What are her intervention needs? Well, she definitely needs continuation of her phonics intervention, but since progress has been pretty limited so far, we would like to find ways to improve it, right? So one important thing to think about is intensity. I'm not sure how it works here in Utah. In Connecticut, I find it's very common in many schools, and this is, in some ways this is kind of understandable because the schools have limited resources, but often the kids are not getting the intensity that they need. So if Danielle is getting, one-to-one with a teacher for an hour a day, that's really good. There's not much room to increase intensity in that case. But I see children like her who are being seen maybe in a group of 5 to 7 children. That's way too big of a group size for a student like this. So I would find out about what's her current programming and is there room to increase intensity significantly, because she certainly needs that. Real word reading is especially weak. We already talked about that. So one person's work that might be very helpful here is David Kilpatrick's work. He wrote a book on advanced phonemic awareness and its role in reading, and advocates testing in this area and training if advanced phonemic awareness is weak. It's important to understand that the initial levels of phonemic awareness that we usually assess in education, like blending and segmentation, that's what you need to kind of gain entry into the decoding system. But really what Kilpatrick is talking about are skills that appear to relate to orthographic mapping, which plays a role in developing sight word knowledge. And not sight word like we use it in education, like irregular words, but more automaticity. A better word for educators would be automaticity of word reading. Boy, that sure describes Danielle. She needs more work in that area. And so, I have in consultations used the program, and it's not really, it doesn't make huge time requirements. It can be blended in with other types of phonics programs. So I would definitely consider something like that for Danielle. Also, another really important consideration is application of decoding skills in reading text. Many children with dyslexia don't generalize their skills to text reading automatically, and text reading is all about reading real words, right? You're getting exposed to real words over and over. So having a component to the phonics intervention where she's reading text orally with a teacher who provides appropriate scaffolding and cues. Appropriate scaffolding is, for example, pointing to a word where she left a sound out and pointing to the sound, not encouraging guessing based on pictures or sentence context, not that kind of cueing, but cueing that would help her apply her decoding skills is another thing that might be helpful. She certainly seems to need decodable text because reading is so low. And I didn't talk about this earlier, but the test data showed that she was particularly weak in her ability to read and spell phonetically irregular words, like, of, done, whom, whose, words like that. And you can really hardly read a sentence without having those kinds of words in it. So that would certainly help her. It's not that we want to shift attention away from teaching decoding, but she also needs that component in order to be able to read and write text well. Okay, so now you do it. That was I do. Now we do. So Zachariah, this is a student who was referred to our assessment clinic due to parental concerns about reading. There's no family history of ADHD, specific learning disabilities, or dyslexia, no early language delay. The child enjoys being read to and is read to extensively at home. Teacher indicates the child does very well with verbal learning and teacher read-alouds. There's no math concerns, and there have been no tiered interventions or special education or anything like that to this point. So here are Zachariah's scores. Again, this is the Woodcock-Johnson. 90 to 110 is average range. And then you also have a copy of Zachariah's core phonics survey results. And the thing that's really relevant here is mainly the last page that has his performance in word reading. So take a look at this and score his performance. It's just like what percent is he getting correct in each category. And think about, remember, he's in March of grade 1. So is his performance in decoding where you would want it to be for a child who's about 2/3 of the way through first grade? Has he mastered any word category? No. So he hasn't mastered even CVC words, right? He has 70% for CVC words. He has something like 50% for other kinds of short vowel words with digraphs, and then blends looks even a bit lower than that. In March of grade 1, should he be able to read those word patterns? Yes. So does he have a reading problem? Yes, he does have a reading problem. What's odd about his standardized test performance, though? It's all solidly average, right? This is exactly the kind of student that before MTSS/RTI models, you'd get a referral for special education and he wouldn't qualify because his reading's not low enough. Okay, what's identifying him are the more informal measures, or like I think he's low on DIBELS, right? So DIBELS, remember, is going to be a more sensitive measure, especially at this age. That's what I find is it's in the little ones. The standardized tests are often not that sensitive to reading problems. If you look at other measures, like a CBM measure, like DIBELS or Ames-Webb, even the informal reading inventory, although it's not a measure I would suggest for universal screening, but it shows he's having problems, right? The core phonics survey shows he's having problems. So he definitely does merit some type of intervention, but what would be appropriate is more like tiered interventions, right? Not a referral to special education at this point. And what type of intervention should he get? Systematic, explicit. We don't want multiple cueing systems. We don't want whole language. We want something that's going to be highly explicit and systematic. Notice something that's probably not qualitatively different than what a student with dyslexia would get, but maybe he's not going to get the same level of intensity, right? Because his problems are not as severe as Danielle's, let's say. But what you want is, you know, provide intervention and then be monitoring so that if it's really not working, then there would be something like a referral for comprehensive evaluation. Just based on the assessment data, do you think that there's a possibility he could have dyslexia? Yes, the test data look very similar to what you would see in a lot of kids with dyslexia at this age. Okay, even the standardized tests. You can't really tell how the kids are going to respond to intervention till you do the intervention. Zachariah, I happen to know because the school where I did my, my field work with my teacher candidates, the school referred Zachariah to the program. So he was getting tiered interventions in school, but they wanted to give him a little something extra. So we worked with one of my teacher candidates who also did phonics tutoring with him. And he did, in the year between March of first grade and like fall of second grade, he had mastered almost everything on the core phonics survey. Not the 2-syllable words. And maybe a couple of the other categories weren't quite there, but really big progress. So he's looking like a child who's probably more like a curriculum casualty or a child who just needed a little bit of extra help, but not a student with a true disability. It would be probably worth, it would make sense to kind of monitor him given the early reading history, but my guess would be he's looking more like a child who probably does not have dyslexia. So, okay, so Teresa was referred to our assessment clinic when she was in March of grade 5 due to parental concerns about reading comprehension. Math was described as strength. The child was said to enjoy math, but really doesn't like reading. She had a history of early language delay that was resolved prior to kindergarten entrance. So she qualified for services as a preschooler, but then had, what the speech paths sometimes call illusory recovery, because these children are at increased risk of reading problems. It's like the language problem manifests in reading, later on. And that's true even if the child catches up. If they have ongoing reading problems, language problems, then they're even more at risk in reading. But very important to know, if a child has a history of early language delay that was documented, even if it resolved prior to entering school, they're at significantly increased risk of reading problems. So Teresa would be in this category. However, recent speech language testing showed her language abilities to be in average range in all areas. Parents said there's no known family history of disabilities. She was diagnosed with ADHD in grade 3. She received special education in the OHI, other health impaired category, which is the common category for kids with ADHD if that's their primary disability. Her history shows she had some difficulties learning to read early on, but decoding is not currently seen as an issue, although her spelling is poor, okay? So right now, in the back of my mind, I have like a little alarm going like ding, 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 ding. Okay, had early reading problems, which is usually decoding, right? Not always, but usually, and she's a poor speller. What goes along with poor spelling? Yeah, and poor decoding usually, right? So that was something that jumped out at me in the history as, okay, something we want to explore more. Is she really on grade level in terms of her word reading? Maybe, don't know. And she's having trouble, this year, when we saw her, she was having trouble because homework and academic demands are escalating and it's hard for her to meet those demands. Here are her test scores. So notice oral comprehension was a little bit low and word attack is a little bit low, Okay, sentence reading fluency, passage comprehension, spelling, all low. Also look at the Dibbles scores. Dibbles next was below benchmark for both accuracy and rate. Okay, so that's important. And then Dibbles next Mays was even lower. That was well below benchmark. Here are some of her error patterns. Maintaining her attention on oral comprehension was difficult and may have affected her score. The kids get tested by teams of grad students, and we had a really big caseload that semester, so we were poaching faculty offices. And the kid was sitting in a faculty chair that, spins around, so she was spinning around. So yes, maintaining attention was difficult. On word attack, the one where she had below average performance, she had trouble decoding nonsense words of more than one syllable. On timed silent reading assessments, such as Woodcock-Johnson sentence reading fluency and Dibbles-Mays, she worked quickly but made many errors. And on Woodcock-Johnson spelling, she spelled many common one-syllable words correctly, but she often omitted phonemes in longer words, like vaction instead of vocation, or electic instead of electric, okay? So she's leaving out relevant sounds in longer words. So it was mainly in longer words. She's one of those kids where there wasn't a lot of automaticity, so instructional level on the graded word list was grade 5, but her independent level was significantly lower than that, only grade 2. On the BRI passages, some of her errors were clearly due to inaccurate reading of words, but other errors were not attributable to decoding. So here's some questions to think about. So do you think, is it true that decoding is not an issue for Teresa? No, it is an issue. It's an issue mainly for what kind of words? Yeah, multisyllabic words, right? So this is a student that if she's going to get phonics intervention, do you think she should get phonics intervention? She should. You want to start with, maybe 2-syllable words, not starting way back with CVC words, right? To be able to, because she doesn't need really low level content. She needs the more advanced types of skills. How could ADHD contribute to her problems in reading? Yeah, so certainly it could affect comprehension if she's not focusing on the text, right? How could it affect decoding? Yeah, if especially in decoding longer words, you have to really look carefully at the letter sequences in the words. And what you said, if she gets frustrated, it seems like she's got some of the behaviors you see in a lot of kids with ADHD, like impulsivity. So you could definitely see that on some of these CBM assessments where she would work really fast, but she was making a lot of mistakes. And maybe some mistakes that she could have done better, but she had an impulsive style of responding. Do you think Teresa has dyslexia?
No. I think she uses her memory to compensate.
I think that there's no one right answer to this question, but here's what I think. I think she had comorbid dyslexia and ADHD. But sometimes when kids have 2 disabilities, one or the other will be more prominent at certain points in time. So I think maybe for the past couple years, it's the ADHD symptoms that have been the more salient thing, and especially her reading problems do not look severe, right? If they were severe, she'd be reading at a much lower level. So she has relatively mild reading problems, it appears, and the ADHD is probably the more salient thing, but that doesn't mean she doesn't have dyslexia too. She could, and especially knowing the high co-occurrence rate of these 2 disorders, I think, and she's showing signs of some phonological types of weaknesses in her errors. It would probably make sense for her to have a workup for dyslexia. I think she could, although, it's just kind of a hunch at this point. What would benefit her in terms of intervention besides phonics? Well, certainly learning like the sight word knowledge that you have to have for decoding, like at her grade level, and spelling, because spelling was a weakness too. What kinds of measures help the students with ADHD? Yeah, things like, organizational strategies, working in a quiet setting, things like that. So she would need, it appears, maybe a combination of those types of things would be helpful to her. My guess is, based on the speech language testing, that she probably doesn't have ongoing language weaknesses, because usually, assuming it was a good evaluation, it would usually be uncovered in that type of evaluation. She had several, so I don't think that that's an ongoing issue for her, but the fact that she had early language delay makes me suspicious about a reading disability, and the type of reading problem she has is kind of looking like it could be dyslexia. Okay, let's see if we can speed through one more, and that's Destiny. Okay, so Destiny is a 6th grader. She was in the middle of 6th grade. She was referred for testing due to parental concerns about her lack of progress in reading fluency. She's already been identified with dyslexia. She was identified at the end of grade 2, receiving special education since then. As is so often true for these kids, meeting general education literacy demands is an increasing problem just because of the sheer increase in volume of, the amount of reading that kids have to do for homework and that kind of thing. Effort, organization, and attention are all seen by teachers as strengths for Destiny. She has been receiving intervention with an explicit, highly structured phonics program for 3 to 4 years. For the past year, she's had one-to-one intervention, so not a lot of room for increasing intensity. Here are her test scores. So notice, this is on the Wyatt. Some tests use 85 to 115 as average range, which the Wyatt does that. So notice, word reading is 86, which the Wyatt considers average, like low end of average range, but that would still be around the 17th percentile. So she's still, it's the same percentile rank, it's the same rank, whether you call it average range or low end of average or whatever. So 17th percentile, she's in the bottom 5th of her age or grade cohort, however, depending on how the scores were calculated. So word reading is not great for a kid who's had so much intervention. Again, pseudo word decoding, totally normalized, solidly in average range. Reading comprehension was very good. She really, on this test, if you give the Wyatt, the child can look back in the passage for answers. And she did that, and it took her forever, but the test is not timed. So there was no penalty for that, and she did great, which is good, but it could be kind of misleading because she put a huge amount of effort in to that average score, and that's reflected in the difficulties she's having meeting everyday classroom demands. Oral reading fluency, accuracy, and rate are both low. So it's not only rate, it's accuracy of text reading. And Dibble's ORF was well below benchmark for both rate and accuracy. Okay, so take a look at her passage, informal reading inventory passage. So this is from a reading inventory called the Basic Reading Inventory by Johns. And this is the 6th grade passage. And so her word accuracy is marked in the passage. SC means self-correction. So notice she had altogether 85% word accuracy. Is that where we want her to be for reading 6th grade? No. Is that like a little bit off or kind of a lot off? It's a lot for this grade, okay? It's a lot for this grade. Think about it this way. At a 6th grade level, kids might be expected to read books that have like 200 words on a page. So if she's got a 15% error rate, that means on every single page she's reading 30 words wrong. Is that a level of error that's going to impair her comprehension? Almost certainly, right? So yeah, so it's 85%. You know, we're used to using like 80% as a cutoff on other tests, and it doesn't sound that bad. But when you're talking about text reading, it's not good. If you look at to use Dibbles again as an example, what the benchmark is to be considered not at risk in 6th grade, it's something like 98%. So kids who are good readers at this grade level read with a very high degree of accuracy. They're not making a lot of errors. Okay, and then look at her comprehension performance. One thing I would kind of like to pull out here, first of all, just take a look at her errors when she's reading the passage. Remember, SC means she self-corrected, and P means the examiner provided her with the word. So she couldn't get it, and the examiner told her. Is she monitoring comprehension while she reads? Is she thinking about meaning? Yes. So that's a strength. Is that pretty typical of kids with dyslexia? Yes. So again, this is pretty typical for a student with dyslexia. She's thinking about meaning while she reads. She is comprehension monitoring. Is she consistently applying decoding skills? Not consistently, okay? Sometimes she does. Sometimes it seems like, you know, she tries to figure the word out. But then other times, she's not really looking carefully at the word. So if you look at like everybody in line 2 versus everyone. Blue instead of faded jeans. Sad instead of the word was supposed to be inferior. Startling for shocking. So she's plugging in words that fit the context, but they're not the word on the page, right? So she is sometimes trying to decode, but she's not doing it consistently. There's a theory in education that if kids make these little errors on function words, but they preserve meaning, it doesn't matter. It matters. So you definitely, with a student like this, and really with all students, not just students with dyslexia, it's very important to expect them to read words correctly. Don't overlook little function error mistakes, little function words like off for the and this for that, because think about it this way. The student needs to develop a habit of looking carefully at the print. And if they're making those little errors, they're not doing that. And if you don't have accuracy, you can't have fluency. Like you need a foundation of accuracy to become more fluent. So if we had more time, the question I was going to ask you is, what kind of intervention does she need to improve her fluency? And one of the first things I would work on with her is more accuracy. And it might need to be a passage, you know, it might need to be reading material that's lower level, because if the material's too difficult, then the student might have no recourse but to guess. So you want instructional level reading, maybe a trade book. Doesn't necessarily have to be decodable because her decoding is not that low, but maybe, you know, a 4th or 5th grade trade book where she's reading aloud, but the emphasis is on, you know, correct reading of every word, not just guessing based on context. Okay, thank you so much, everybody.